If you are 65 or older and you are collecting Medicare right now, I need you to stop whatever you are doing, put the phone down, pause what you are watching, and stay with me for the next few minutes. Because what I am about to walk you through could be costing you hundreds of dollars a year, silently, automatically, without a single person from the government picking up the phone to warn you. The Centers for Medicare and Medicaid Services, the agency known as CMS, has officially confirmed that the standard Medicare Part B premium for 2026 is $202.90 a month. That is the number. That is what most people on Medicare are supposed to be paying. But most is not everyone. And that gap, the space between what you are actually paying and what you should be paying, is where the money disappears. Not by a little. I am talking about programs that could reduce or eliminate that $202.90 entirely. Programs that CMS estimates are being missed by 2 to 3 million people who qualify right now but never applied. 2 to 3 million people. People exactly like the ones watching this video. So before you assume your bill is correct, before you assume somebody would have told you if you were leaving money on the table, stay right here. Because the system is not built to chase you down and hand you money. That burden falls on you. And today, we are going to fix that together. Here is something that nobody from the government is going to call and explain to you. Medicare does not send a counselor to your door. The Social Security Administration does not assign you a personal advocate who reviews your situation every year and says, hey, wait, you are overpaying and here is how to fix it. What happens instead is this. A number gets calculated. That number gets deducted from your Social Security check before it even hits your account. And unless you specifically go looking for a correction, that deduction just continues. Month after month, year after year. The burden of knowing what programs exist, who qualifies for them, what forms to file, and which phone numbers to call falls entirely on you. Not on the agency, not on your Medicare plan, on you. That is not an accident, and it is not a conspiracy. It is simply how the system was designed. And it means that millions of people are quietly losing money they legally earned the right to keep. Stay with me until the very end of this video. The last step I walk you through is the one that almost nobody takes, and it is the only step that actually moves money back into your account. I am going to explain exactly why this overpayment happens, how to check whether you are affected, and precisely how to fix it, including the exact words to say when you call. That is the roadmap. Why it happens, how to check, how to fix. If you are not subscribed yet, do that right now and turn on the bell. Social Security rules, benefit calculations, and correction procedures change every single year. When they change, nobody from the government explains what it means for your specific situation. That is exactly what this channel does. Subscribe and let us get into it. Now let me teach you the real mechanism behind all of this. Because once you understand how the $202.90 number works, you will understand exactly where the loophole lives. Medicare Part B is the part of Medicare that covers your doctor visits, outpatient services, lab tests, preventive care, the part you use most often. Unlike Part A, which most people do not pay a premium for, Part B comes with a monthly charge. Every single year, CMS calculates what that charge will be based on projected spending across the entire Part B program. For 2026, the Centers for Medicare and Medicaid Services set that standard monthly premium at $202.90, an increase of $17.90 from the 2025 rate of $185. That nearly 10% jump is the largest in several years, and it marks the first time the Part B premium has ever crossed the $200 mark. For most people collecting Social Security, that $202.90 gets quietly deducted directly from their Social Security payment before the check is even sent. You do not write a check. You do not get an invoice. It simply comes out. But here is what CMS does not broadly advertise. There is an entirely separate set of federal programs called Medicare Savings Programs, administered by your state Medicaid office, that can reduce or completely eliminate that $202.90 monthly charge depending on your income. These programs exist under federal law and they are not charity. They are legally established benefit programs that you may have already earned the right to receive. The four programs are the Qualified Medicare Beneficiary Program, known as QMB, the Specified Low-Income Medicare Beneficiary Program, known as SLMB, the Qualifying Individual Program, known as QI, and the Qualified Disabled Working Individual Program, known as QDWI. For most seniors 65 and over, the first two, QMB and SLMB, are the ones that matter most. QMB covers your $202.90 Part B premium entirely, and it also covers your Part A premium if you have one, your deductibles, and your coinsurance. SLMB covers the Part B premium. Both programs stack on top of a separate federal program called Extra Help, also known as the Low Income Subsidy, which is administered by the Social Security Administration and can eliminate most of your prescription drug costs under Medicare Part D. The Inflation Reduction Act made the Extra Help program even more valuable starting in 2024. Before that law took effect, there were two tiers of Extra Help, a full subsidy and a partial subsidy. The IRA eliminated the partial tier and moved everyone into full coverage, meaning that if you qualify, you now receive the complete benefit regardless of exactly where your income falls within the eligibility range. CMS estimates the annual value of Extra Help alone at around $5,700 per person. That is not a small number. That is nearly 5 of those $202.90 premiums paid for you every single month of the year. And here is the thing that should make your stomach drop. CMS has estimated that somewhere between 2 and 3 million people who are eligible for Extra Help have never applied. Not because they chose not to, because they did not know it existed, or they assumed someone would have told them, or they heard the word Medicaid and thought it did not apply to them. It does. And the Medicare savings programs that cover your Part B premium are not something you are automatically enrolled in. You have to apply. The system does not come looking for you. Let me make this real for you with a story. Picture Dorothy, a retired school cafeteria worker from Dayton, Ohio. Dorothy turns 72 this year. She gets a Social Security check every month, and for the past several years, $202.90 has been coming out of that check before she ever sees it. Dorothy's monthly Social Security benefit is $1,340. After the Part B deduction, she takes home $1,137.10. Dorothy lives alone. Her rent is $780 a month. After rent, utilities, groceries, and her copays, there is almost nothing left. She has heard of Medicaid, but she assumes it is for people who are completely broke, people much worse off than she is. She does not know that the Qualified Medicare Beneficiary Program uses income thresholds set by her state, thresholds that may well include her. She does not know that if she qualifies for QMB, her state would pay her entire $202.90 Part B premium, and that adds up to $2,434.80 a year, going directly back into her pocket. She does not know that the same application that gets her into QMB would automatically enroll her in Extra Help for her prescription drugs, saving her potentially thousands more. Dorothy is not unique. Dorothy is millions of people. And this story is illustrative, but the math is completely real. This is what not knowing costs. Now let me give you the facts that prove this is not a fringe issue. The Medicare Rights Center has confirmed that there are approximately 50 million Part B beneficiaries currently enrolled in Medicare. CMS itself estimated as recently as 2023 that up to 2 million people who are eligible for Extra Help, the program that can cover your drug costs, have never applied for it. CMS data shows roughly 12.5 million Part D enrollees are already in Extra Help, but the agency acknowledges the gap between who is enrolled and who qualifies is in the millions. For the Medicare Savings Program specifically, the income thresholds for the specified low-income Medicare beneficiary program and the qualifying individual program are higher than most people realize, and some states have expanded their own thresholds above the federal minimum, meaning you might qualify in your state even if you think you earn too much. And separately, for those with income above $109,000 individually or $218,000 as a married couple, there is a surcharge called IRMAA, the Income-Related Monthly Adjustment Amount, that can push your monthly Part B premium from $202.90 all the way up to $689.90. If your income has dropped since the year CMS is using to calculate your IRMAA, you may be able to appeal that surcharge and bring your premium back down immediately. The number $202.90 is not the ceiling. It is the floor for most people, and the system will not automatically lower it for you. Now here is how you actually fix this. 3 concrete steps, and you can start all 3 of them today. The first thing you do is go to ssa.gov. That is ssa.gov. Once you are there, you are looking for 2 things. The first is your Medicare summary notice or your benefit verification letter, which will show you exactly what Part B premium amount is currently being deducted from your Social Security payment. You want to confirm whether you are paying $202.90, something higher because of IRMAA, or possibly a lower amount because of the hold harmless provision that protects people with very small Social Security checks from having their benefits reduced. The second thing you look for on ssa.gov is the Extra Help application, also known as Form SSA-1020. You can find it directly at ssa.gov/Medicare/Part-D. This is the application for the Extra Help Low-Income Subsidy that covers your prescription drug costs under Part D. For 2026, if your individual income is at or below $23,475 per year, that is $23,475, you may qualify. For married couples living together, the limit is $31,725 per year. If you fall within those numbers, fill out Form SSA-1020. Submit it online at ssa.gov/Medicare/Part-D or call 1-800-772-1213. That number again is 1-800-772-1213. And tell the agent exactly these words. I would like to apply for extra help with my Medicare Part D prescription drug costs. My name is blank and my Social Security number is blank. That is it. The agent will walk you through the rest. SSA typically processes extra help applications within 2 to 3 weeks when submitted online or by phone. The second step happens in parallel, and it is just as important. You are going to contact your state Medicaid office, not SSA, your state Medicaid office, to apply for a Medicare savings program. This is the program that could eliminate your $202.90 Part B premium entirely. You can find your state Medicaid office by going to Medicare.gov and clicking on the tab that says Get Help with Costs. You can also call 1-800-MEDICARE, that is 1-800-633-4227, and say these exact words. I am a Medicare beneficiary and I would like to find out if I qualify for a Medicare savings program in my state. I need the contact information for my state Medicaid office. The representative will give you the number and the application process for your specific state. Income limits vary by state because some states have raised their thresholds above the federal minimum. But in most states, the QMB program covers individuals with income up to approximately 100% of the federal poverty level, and SLMB and QI extend higher than that. Many states have removed the asset test for these programs entirely, meaning your savings account balance may no longer disqualify you the way it once did. When you call your state Medicaid office, say, I am on Medicare and I want to apply for the Qualified Medicare Beneficiary Program or the Specified Low-Income Medicare Beneficiary Program to get help paying my Part B premium. Write those words down and say exactly that. And now, here is the third step, the one almost nobody takes, the one I promised you at the beginning of this video, the one that actually moves money into your account. Most people who go through steps 1 and 2 file their application, get approved, and then assume everything has been handled. It has not. Here is what they do not tell you. The Medicare Savings Program approval from your state has to be communicated to CMS, and CMS has to update the premium record that feeds into your Social Security deduction. This does not happen instantly. In many cases, it does not happen automatically enough to catch the next month's deduction. What you must do, and this is the step nobody takes, is call 1-800-772-1213 after you have received written confirmation of your Medicare Savings Program approval and say these exact words to the agent. I have been approved for a Medicare Savings Program, and I need to confirm that my Part B premium deduction has been updated to reflect that approval. I need to verify that I am no longer being charged the standard premium and that any months I have already been overcharged will be corrected. Do not assume the update happened. Call and confirm it. Ask for the correction in writing. Ask when the change will appear in your Social Security payment. Because until you make that call, the deduction could continue, and the months where you were already paying and should not have been may quietly disappear unless you ask for them back. So let us bring it all the way home. If you are 65 or older and you are on Medicare right now, the confirmed 2026 Standard Part B premium is $202.90 a month. That is $2,434.80 a year coming out of your Social Security check. CMS has officially confirmed it. The Federal Register published it, and it is the law that you may qualify for programs. QMB, SLMB, QI through your state Medicaid office, extra help through SSA using Form SSA-1020 that can eliminate or dramatically reduce that $202.90 for the rest of your life. Not temporarily, not as a one-time adjustment, permanently, for as long as you remain eligible and you keep your enrollment current. The income thresholds are higher than most people think, up to $23,475 a year for individuals for extra help, and state Medicaid programs that go even higher for the Part B premium programs. 2 to 3 million people who qualify are not enrolled. Do not be one of them. Send this video to one person you love who is 65 or older and collecting Medicare right now. One share takes 10 seconds. You could be sending someone you care about the exact information that saves them $202.90 a month, and potentially far more once the drug savings and the deductible protections stack on top of that. They will not get a letter from the government explaining this. They will not get a call. The only way they find out is if someone who watched this passes it along. That one action, that 10-second share, could be worth thousands of dollars to someone you love, permanently, for the rest of their life. That is not an exaggeration. That is the math. That is what this channel is here to do. I will see you in the next one.